So I work with a collaborative called the Food is Hope, Food is Health Collaborative, and it's an emerging collaborative of over 20 different organizations from various sectors within Portland, the region, and statewide. And we're working together to try to address what we call the developmental origins of health and disease. The developmental origins of health and disease are utilizing a more upstream approach to what we more commonly refer to as the social determinants of health. What the social determinants of health tells us is that there are a number of different issues that contribute to the health of communities. Issues around transportation, education, access to nutrition, and the lack of these resources, which contributes to something called toxic stress. So the Food is Hope, Food is Health Collaborative is an emerging cross-sector, multidisciplinary collaborative made up of over 20 different community partner organizations. We have three key areas that we are working towards: increasing the nutrient level of the entire community, creating food systems that can be engines of economic development, and strengthening existing support networks in the community. And we have the overall goal of really creating momentum and the urgency necessary to encourage our community partners to move beyond their cylinders of expertise, or what more commonly referred to as silos, in order to create cross-cutting, cross-sector, innovative solutions that can try to bridge the world around service delivery and short-term needs for community members with long-term strategies and approaches. So what we try to do, or the functions of this group, are, we've got 5 main functions: to link and leverage, to build capacity, to translate the research and information around the developmental origins of health and disease, and to provide training and leveraging the resources that the Portland State University and Oregon Health Sciences University has in a number of different research areas, as well as the student interest. So a little bit more about that. Within linking and leveraging, we're hoping to engage community members, convene and facilitate conversations to help our collaborators build and expand current efforts, accelerate progress, and realize and generate shared goals. We're hoping to build capacity of communities, organizations, agencies, governments, community members, so that they can understand what their unique and necessary role is in addressing the developmental origins. We want to translate the research, because it can get very tricky and complex very quickly, with community members, so to support their specific work and empower them to be able to utilize the framework of developmental origins in their own work to create change in their communities. We want to provide training, tools, and technical support in framing the issues, creating communication and talking points to help leverage and build advocacy efforts. And finally, we hope to leverage the tremendous resources at PSU and OHSU in things like evaluation, community-based participatory research, to generate evidence-based practices and establish metrics to assess programs over time. There's a tremendous amount of food system activity in Portland, everything from really addressing all aspects of the food system. So we've got great work that's happening at the producer end around farm workers' rights, the Oregon Tilth, a lot of urban agriculture happening, all the way through different programs that help to find compost facilities and reducing waste in the food system. So in relation to our particular project, again, what we're looking for are comprehensive approaches that use food systems as a strategy to actually build and develop community health. And within that, one main goal is to help to build community capacity in addressing their own needs. So there's an example of an organization that I'm going to give you that does just this. It's called Village Gardens, and they are placed in New Columbia, which is an area of high poverty, high diversity, racial and ethnic diversity, a lot of immigrants, a lot of youth, and they have a comprehensive program that helps to build the capacity of the community in both identifying and addressing their needs using food systems as a strategy. So, for example, they have a youth employment program called FoodWorks, and this allows teenagers to work on a farm on Sauvie Island grow their own food, organically grown food, and then sell it to farmers markets, to new seasons, and to have a very small CSA. But the point of the program, while they're using food systems as this lens to connect and the farm to be growing on, what they're really doing is growing these youth and growing them into the leaders that they need to be able to bring themselves out of poverty and some of the conditions that they are growing up in. So while they are getting paid to do the work and they're learning how to grow food, they're also learning how to be responsible. They're learning how to be a good collaborator and have multiple leadership opportunities. Village Gardens also has something called the Village Market, and this is in response to what we see in communities all across the country, in areas that we more commonly refer to as food deserts. These are areas that have very low access to food, and so the Village Market was built and developed in response to this neighborhood, which is referred to as New Columbia. It's housing projects and very low-income area. That the only grocery store was a couple miles away, and it didn't necessarily reflect the needs of this very diverse community. So they started something called the Village Market, which is subsidized by HUD and is in support of, which is supportive of the entire community. HUD is, and it's owned and operated more like by community members, and it has the product selection that reflects the needs of the community, and the community was very deeply involved in developing what that product selection would look like. So for example, they chose not to have any alcohol or tobacco, and they moved all of their candy and high sugar items behind the register to try to encourage people not to buy some of those impulse purchases. They have a very large produce section and bulk section. It's a really, really fantastic store and a very strong community builder. They also have a community health worker model. So they employ community members from the community to communicate and help community members navigate some of the healthcare system. And this is a model that's being utilized more and more as a way to build capacity within a community, to build skills and leadership development within community members, and really acknowledge that there is a distinction between the patient approach and the doctor approach, and kind of the medical model, and acknowledging that a lot more can be gained when you utilize community members to help bridge those two worlds, and helping individuals navigate the medical world, as well as the community health workers having a stronger grasp on what's happening within the community members' lives. And then they also have a community garden program, and this helps to offer opportunities to both adults as well as pre-K and very young kids and families, opportunities to grow their own food. And they really use community gardens as a way to build community and help to strengthen the networks of members within the community. So that's an example of an organization that is using food systems as a strategy and a lens in order to convene and bring people together. However, their goals are much larger than just food access or just food security. They're really trying to improve the health of the whole community by getting everybody involved, using community organizing strategies, and helping to lift up the whole community by using food systems as a way to bring people together.